Hi, I'm Alex Mitchell and I'm the creator of Cancer Stories. Cancer Stories is a video diary program which is designed to help people like yourself manage their cancer. And the key aim is to record previous patients' experiences, really a wide variety of cancers. And these are patients who are genuine, real patients from Leicestershire who've given their consent to allow us to record their story onto DVD or the internet. What we ask those patients is really to give a brief account over 30 or 60 minutes. How did they manage with their diagnosis? And hopefully by watching their account, you'll be able to pick out some common themes from one or more of those videos. And those common themes might be things like what resources are available locally or nationally, or how do families cope, or how do people themselves manage with those awkward stages, either the initial diagnosis or the complications of treatment, or perhaps psychological and emotional complications, which are sometimes overlooked. So overall, we hope that by watching the video diary program, you'll be able to take some positives from other people's accounts, and hopefully that will help you better cope with your situation, whatever that is at the current time. Thanks for watching.
Hello, my name's Debbi Smallwood, although I like to be referred to as Debbie. I've been married for 33 years now, still happily married. I've got two grown-up sons. The oldest left home, got married, and then he came back, and now my youngest has left home, so I seem to be keeping one or the other sons anyway. I work for the co-op. I'm actually working in refits, so you might see me in any co-op round the Midlands, anywhere from Birmingham up to Chesterfield, and all around that area. I'm the one that goes into the stores when you go to bed and change it all around. This was my job. I'd been doing it for 10 years until I was diagnosed in 2010 in July with DCIS in my left breast. So diagnosed with breast cancer literally 2 weeks after my 50th birthday.
Debbi Smallwood's come in today. Thanks for coming in. She's agreed to come and tell us about her recent diagnosis, which I think was from 2010, you said.
Yes.
How was the breast cancer picked up in your case?
Well, for a start, I noticed some spots of blood in the bed. I thought nosebleed, things like that, but it was too low. Now my husband's on heart tablets and occasionally gets little nicks in his fingers, so my thoughts were arm round me. Didn't really connect what it was, couldn't work out what it was. And at the time, unluckily, I was wearing black bras because the ones I bought were in packs of 2, and I was getting rid of the black ones because I didn't like them. Anyway, for my 50th birthday, one of my treats was a couple of nights in London. So off we toddled to London. It was a week after my birthday. We tootled down there. Lovely big white bed in the hotel. Woohoo, jumped in. What's that on the bed? There's a spot of blood. And instantly seen it was from my breast, from my nipple. So that sort of ruined the weekend. Off we went back home, straight down the doctors. Then I was taken obviously sent straight to Glenfield. And I had mammogram both sides, and then I had an ultrasound. They said they couldn't really see anything, but there was dark areas that they thought was calcification or something like that, so they thought a biopsy would be ideal. So I went back for the biopsy. All through this, being Mrs. Positive, thinking cysts, something I can deal with. Anyway, the appointment was to go back for the results. Went into the room, my husband sat behind me and he still said, "What do you think?" And I says, "No, it'll be nothing." Miss Yukui walked in the room and I seen a surgeon, and my husband said my face dropped, and I think from that moment it was panic. She said, "We found cancer in two out of the 3 biopsies, I think it was." So she says the cancer, although it's contained, it could be anywhere within your breast. So it might only be a tiny bit, but the safest way to do it is to take the whole breast away. I had that done in September. I had the mastectomy on the left side, and they also did the biopsy on the lymph glands under my arm. Again, I told them at work, "See you after Christmas, breast off, implant," because I had the implant put straight in, thinking it was, being told it was just contained within ducts in the breast. Anyway, back for the results after that, and again, Miss Yukui, bad news, I'm sorry, the lymph glands had got cancer in them, so we need to take you straight into chemotherapy. Horrible sensation then, thinking this is getting worse and worse. Mrs. Positive, down a bit anyway. Off I trundled into the chemo. Horrible. I had FEC T, which was 3 of the FEC, which is the red stuff. That's the one that makes you sick. Although I was very sick with the first dose. So sick, in fact, I couldn't even take my anti-sickness tablets because they were making me sick. I had to go down to the GP and get an injection in the end. The second dose, a little bit sick, but better. However, that's when my hair started to fall out. First start, it's, again, I can deal with this. But it is such an awful sensation when you go, and I said to my husband, "It is coming out. I'm going to go and wash it hard." And I went and put my head in the bath and I went like that, and I had a handful of hair. So we shave it off, so it was shaved off. I did go and get a wig, but I never ever wore it. I felt that because the chemotherapy had obviously started my menopause or whatever, I was having awful hot flushes. Now, you can wear a hat out and take it off, and that makes people go, "Ooh, she's got no hair," but it's bearable. But I think that I would probably frighten people if I had to take my wig off because I was hot. And the hot flushes were that bad, I literally had to take everything off down to a t-shirt, even in the winter. So I just left myself with a bald head, and I lived with that. Anyway, the 3 FECs were finished, and then I went on the Taxotere, I think it's called. That's a doddle to have, but it feels as if you've had, literally, you've been chucked on the floor and you've been kicked in all your bones. Every joint hurts, your hips, your fingers, your jaw, every little bit that moves hurts. I don't think there's anything they give you for it. I think it's just something you live with. But through this, I've seen different nurses every time, although I always knew that Lucy was Dr. Osmond's main nurse. But the chemo suite ladies were absolutely, and men, were absolutely wonderful. They were rushed off their feet. The place is absolutely heaving. I don't know how they deal with it all. There's so many to treat, and they haven't got time to be sympathetic with you, but at the same time, my thoughts are, it's like my veins really suffered very quickly. They can't be, they're sympathetic, "Sorry, we're hurting you, sorry," but they've got to do it. And I think that, I sort of live with that. I know it's got to be done. I mean, one attempt, I had seven goes before the needle went in, which was horrific. I was covered in plasters, but it's got to go in. You haven't got any choice. You can't have it any other way. So anyway, my chemotherapy finished. And just started to get little bristles back on my head. And then I had to go for the lymph node clearance in April 2011. So we're now into the next year. I had that done and went back to see Dr. Osmond. Now, he said that the lymph nodes were, only the very top part was affected. So he would give me 3 weeks of radiotherapy. So that started in May. Again, rush. I had very early ones, so it was quite good. The car park was excellent. Straight in, get the radiotherapy, and back home by 9:30. Quite frightening sitting under that machine, but you feel nothing, and again you feel nothing from it all. That finished, and straight on to Herceptin, which again is given in the chemo suite every 3 weeks for a whole year. Now, as I was starting my Herceptin, I was getting an awful lot of pain from the breast area. It was hard. It was like having my example was a brick in my bra. Mr. Cooey looked at it occasionally, a couple of times, and she said that it had encapsulated, or it was scar tissue. There was a lot of scar tissue around it. So during my Herceptin, I think it was November 2011, the first time I had it, I had a fat transfer where they give you a bit of liposuction on your tummy and inject it round the breast, which apparently fat tissue has got lots of blood vessels, scar tissue hasn't got any or very few, so by putting the two together it can actually dissolve scar tissue. That didn't work anyway, so back in again in April this year for removal of the implant, and she put me a smaller one in. Now all this time I've been in an awful lot of pain. I've been increasing painkillers all the way up, and I'm on quite heavy painkillers. I mean, I started on amitriptyline, I went up to gabapentin to full dose. Still the pain. So all this time I haven't been able to return to work because of the pressures of it, and the pain eventually started to pull me down. And I'm thinking, this is positive, it's going to live to be 100. Why am I still hurting? Is my cancer still there? Is there something I can't see? Is it going to kill me? And I started to spiral down. I didn't realise this, but I was going to La Rosse at the lymphedema clinic because through the various things, I haven't had a lymphedema, but I had a bit of a little bit of swelling above the breast, so that was just being kept an eye on. I went to see her at La Rosse, and I spent the whole hour crying, telling her pretty much my life story of my pain. I went to the GP and I was crying in front of her. The Macmillan nurse came, same with her, and I think between the three of them they all said, you should have a bit of counselling, you are struggling. I'm the sort of person that thinks counselling, what a load of rubbish. Go on, I'll give it a go.
So you were quite sceptical initially? I
was. I mean, as I say, I deal with, everybody comes to me in the family. I'm a bit of a team leader in the family, I think. I'm the mother figure. Everybody comes to me with a little problem. So I couldn't see I'd got one myself, and in the end, as I was told at my counselling, I was protecting myself and protecting everybody else with this shield around me. So I started the counselling, and I explained that I have fears of death. Cancer to me meant death, and just saying that had me sobbing. As you can see, I can say it now. I had quite an intensive, I had 16 sessions altogether with Jules at La Rosse. Wonderful lady. I said to her, I don't know what you've done, and she said, you've cured yourself, but I said, I know you know where to pick though. You've pulled the little things out of me that I need to talk about. I went there originally with what I call a bucket list, which a lot of people say now, things to do before they die. And through my counselling, I have now got it as a life goal list. Still the same things on it. Going to China, I want to walk the wall. That is my main aim in life, to walk the Great Wall. We set that for 2014. However, my son's now told me he's marrying in 2014, so I may have to put that off by a year.
So you prefer the idea of a life goal list?
I do, because
bucket list.
Yeah, I think I've worked out that my pain is not cancer, or I don't think it's cancer. The pain is caused by this implant. Mr. Cooey has agreed that maybe I'm one of those persons it doesn't suit. So I'm now on the list for a reconstruction to have the flap from the tummy tuck and the breast, which I hopefully get after Christmas next year. So although I'm on a lot of painkillers still, I'm still in pain, I do see an end to it. And through my counselling at Loros, and then with Sue, because that's a funny story. Halfway through my counselling, I was getting stronger, and I explained to Jules that when I go to the oncology suite to see Dr. Osman, which I've seen every third Herceptin, I never seen Dr. Osman, I always seen a different doctor. Or a registrar, and I'd go with my list of questions, but I found I was in tears before I could get answers to them, and I'd walk out and I think I found out nothing here. So Jules suggested I write to Dr. Osman. Oh, no, that's scary. No, she says, you do it. He's your doctor, he's there to help you. So I spent 2 weeks and I wrote a letter and I explained that I was in a lot of pain and I couldn't work out if it was cancer, if it was the implant. Could I talk to somebody? I needed help. Anyway, the next time I went, the nurse come and fetch me, and she says, you're seeing Dr. Osman today, that's a treat. You don't see people like you very often. So I'm thinking, uh-oh. And I walked in and sat down, and he said, hello Deborah, are you all right? And I says, yes, thank you. He says, are you sure? Yes, thank you. Did you get my letter? And he said, yes, thank you. But he sat with me for 20 minutes, half an hour, and he talked through everything I'd wrote. And he said to me, would you talk to somebody from my team, psycho-oncology? I said, I will talk to anybody if they'll help me. And he recommended Sue to me. So I was seeing Sue and also still seeing Jules, but they were working with different areas, so they could work together. So between the two of them, they've pretty much put my head back on.
What's it like looking back on that time? Because you were somebody who were sceptical about asking for help. Now I think, wow, I can see what she's done for me, as I say, and Sue is still working. I'm pretty much there. I still fear cancer, and my positive thoughts of living to be 100, which was my life goal. I say, well, I've had cancer, so maybe I won't, but maybe I will, so you've still got that. My positive, my cup is half full again, instead of it would be, I was so down. I didn't realise how low I was. People would come in and say, are you all right? No, and I really couldn't cope with what I was dealing with myself. I put weight on, which is bad for yourself. You lose your self-confidence, you lose who you are. You suddenly become this person that's being taken through it all, which when it happens is fine. You're going through this routine of an operation and chemo and operation. You're under an umbrella, and suddenly it stops. And I think it does cause a panic. You suddenly got nobody that's looking after you, and you think, well, will it come back now and nobody will know? So through the counselling, it's taught me to lift myself up and think positive myself. Coping with cancer also, I've discovered that. That's because that's in the voluntary sector there. That's right. They offer additional group therapy. Yeah, there's one sessions in Colville at the Marlene Reed Centre, and a lady I met on my first hospital when I had my mastectomy. I met a lady who was having a lymph node clearance, and we've stayed friends throughout. We've had pretty much the same treatments throughout, and it's been quite good to meet up with her every 2 months or so, and we have coffee and cake, and then we've started to do this coping with cancer together, and it's quite good just to sit and have a talk, although I'm not into the group thing. I prefer a one-to-one, but it's nice to go there with Janet, and we sit and we talk, and we're going to have a little bit of complementary therapy, and it's quite nice. Do you think it's important to meet other patients who've been through similar things?
I like to talk one-to-one. I think, I'd offer to talk to somebody one-to-one, but maybe not in a group. That doesn't really appeal to me.
So let's have a think about the factors that were contributing to that stress building up. I mean, you had a lot going on, didn't you? One, you'd obviously been through the original diagnosis. Two, you had the implants, which hadn't really gone well initially. And three, you had persistent pain. Yeah. Which was
I have persistent pain.
Still ongoing.
I'm still fidgeting now, and yeah, I've still got a potato in my bra, and my bra's too small. And occasionally this potato gets spikes, so instead of it being a heavy, at the moment it's, as I'm sitting here, it's a heavy, uncomfortable, it's not pain as much as it's very uncomfortable, but it also has spikes on it, and then that becomes a pain in the feeling.
Now there's obviously people out there who are in different stages and different conditions, but some will identify with what you've had as well. Yeah. What would you say to those people about how to cope with those difficult complications?
As I say, I've been on painkillers in the hope of that helping, and I'm still on gabapentin full dose, plus I take paracetamol all day, or cocodamol if it's quite bad. So to me that is too much to take, with
it's a lot of tablets.
Yeah, it's a lot of tablets, and I'm still got the uncomfortableness. So it was the thought that I'd got two choices really, and that was to have it removed and have nothing. That to me would frighten me. I think that would take me down again, because throughout this, and I have actually praised Miss Shikui for it, when I've looked down at my breast, although I'm very uneven, which I'm also aware of, if I look down at myself, I can't see anything wrong. I haven't got a nipple, and I'm odd, but I can't see the scars. And I actually frightened my mum, and I didn't realise how it was. And I said to her, would you like to see what I've had done? And I showed her, and she cried. And I suddenly realised I can't see that, but everybody else can see what I've been through.
Is that because you'd got used to that change in appearance?
Yeah, I can still look down and not see it, which is good up here. But
was that the case even early on?
That was early on, yes. It's the constant pain that's pulled me down, I think. Not being able to go back to a normal life. A normal life as can be. Wanting to go back work because I've not been able to go back work, and I actually got judged as being a health and safety risk, and I wouldn't be allowed to back work on the tablets I'm on. I actually went up to one called pregabalin, and that was being increased, and all of a sudden I was falling over, and my speech was going strange. I still do it now. It'll probably come up on this video. Every so often I miss a little bit of a word.
So you were actually noticing side effects?
I was really frightened, because I have benign MS. No signs of it. I had it in 1995, and I've not had it again since. And I thought, because I was tripping over, my speech was going, the MS was back. So I had to go and have an MRI scan, and I seen a doctor, the neurologist, but that's all come back fine. That's not returned. So then it was turned to these tablets. So I have dropped back down to gabapentin now, and I'm not falling over, and my speech is nearly back. So yeah, that showed that those were too much.
They were too strong for you?
Yeah. So although I'm in more pain again, at least I'm not falling over, I'm going to break something.
Now one thing that people say is about pain, if you try to keep active and maybe do more, just the fact that you're doing these other activities can act as a form of useful distraction from the pain.
So the first thing I started was, I call it the Granny Keep Fit. There's an over 60s Keep Fit in the village. So I started that, sit down for half hour, stand up for half hour. And that actually gave me my movements back, which was really good. So then I started on it's Zumba Gold, which is again for the over 60s. Sit down half an hour, stand up half an hour, but more intense than the Keep Fit. And now I do a regular Zumba. I'm a Zumba freak, but the first thing I was told was I wouldn't get this reconstruction unless I lost some weight. Now, part of my therapy with Jules was to go for a walk, to go outside and just go and get some fresh air and think. And I used to have an old bridle path up the village, because I used to ride a horse, so I know where the bridle paths are, full of mud and puddles, and I'd go and put my wellies on and go up there and play. And it was very embarrassing if people caught me, but I think that was the start of my cure, because suddenly I was enjoying to be out. I wasn't thinking of myself, my pains. Then my son said, why don't you have yourself a little iPod and have some music on? So he sold me one. Didn't give it to me, he sold it me. Put all my CDs on, my whole collection on this iPod.
And what kind of music do you like?
I've got everything. I've got Steps, I've got Queen, country and west. I've got all sorts. I've got a very wide range, even some club music. I find that the Venga Boys is a very good walking tunes.
Oh, so you listen to this when you go out?
Now I'm walking 6 miles, and I just walk and walk, put my earphones on, and that has actually put my head right. And in 2 months I've lost 1.5 stone. My body is not just the weight, my body has tightened, strengthened, fitter. I mean, I walk up the hills without, being out of breath. And the Taxotere, as I said, when I had my chemo, left my bones really bad. And up till about 3 or 4 months ago, I was still having to walk down the stairs holding both sides in the mornings. Very, very sore. This walking and the losing weight has helped this as well.
Would you recommend that regime to other people?
I think that through chemo and through it all, you do go downhill. Some people don't. I've heard of some that don't, but I think if you put your weight on with your steroids, you sit about, you're uncomfortable, you eat, you watch the telly, and you don't realise that it's not just the weight, it's your whole muscle tone of your whole body that you lose.
They call it deconditioning, don't they?
Yeah.
When you've been unwell or inactive for a period of time.
Yeah.
It takes quite an effort to start again.
It does, and I think it took probably a month. I wasn't losing any weight at all. Suddenly, my husband said, "You look different." And although my weight hadn't gone, my muscle tone had picked up, and I think that caused me then to want to walk further. I would like to lose more weight, but I've got to be careful I don't lose too much, so there's no tummy fat for Mr. Varma after Christmas. I'm at my target weight now, so I just keep that now.
People will be interested, what's the effect of the exercise on the pain?
None at all, really. It just, as I say, it's permanently there.
What about during the exercise?
It doesn't make it any worse or any better. It's just always, I can feel it.
Is it less noticeable when you're exercising? Because your mind's not...
Sometimes, yeah. But Sue gave me a relaxation CD, which I've tried. And it is nice, and you tighten and you loosen, and everything's lovely. And I can lie there and I feel very relaxed, except for this weight on my chest. And even then, I have got this weight on my chest. It's something I can deal with, but something I want to get rid of, I think. As I say, if I wasn't taking the tablets, I would say I'd live with it, because I could take something if it got too much. But to be sitting with it and all that medication as well, it just gave me the decision. I always said I wouldn't have the massive operation, but I think it's got to be done just to try. There's no guarantee, but I've been told there's no guarantee, but at the same time this implant needs to come out. Give it a fresh start. I mean, my one example, again, Mr. Varma said, describe the pain. So I said the potato and the tight bra. I says, now, inside there, where my breast's been removed, is that healed up, or is that still a raw wound? He says, oh, no, that'll be healed up in there. I said, well, it doesn't feel like it. It feels now like, and it's actually getting sore as I'm sitting here, because I'll soon be due for tablets. It feels now like that is pressing on a grazed, a sore. If you've got a graze, how sore it is, that is how it feels all the while. It's like it's that area that big is just sore. So although it's not what I'd call probably a pain all the while, there's always a feeling all the while.
Did you ever try any alternative pain reliefs? For example, a TENS machine, which is electrical stimulation.
No.
Or complementary treatments, acupuncture, aromatherapy?
No, I haven't, no.
Would you be interested in any of those?
No, I think at the moment
You've got a plan.
I've got
You
the
know where you're
plan.
going.
I'm going with this now. So.
Is there anything you feel could have gone slightly differently for you, or you look back on in a different way?
Well, yes. I mean, and Miss Shikui would say the same thing. If we'd have known the diagnosis wasn't right, she wouldn't have put the implant in. So maybe I'd have been back at work a long time ago and having this reconstruction at my own time, or not even having it. But when I was diagnosed and told I have my breast off, I was offered just the flat chest, etc. And I said, no, I don't think I can deal with that one. So it was my decision to have the implant.
Did they discuss that with you as an option, or did you just say, I can't manage?
No, it was an option. As I say, Miss Shikui said, we need to remove the whole breast. Your options are, we just leave you with nothing, and we'll give you the artificial in the bra one, or you can have the implant, or we can do the bigger surgeries. And I said at the time, I don't want to be without. I don't want to deal with a massive surgery. I want to get back to work. So I decided on the implant. And obviously if we'd have known, if Miss Shikui had known, we wouldn't have had the implant, and maybe this wouldn't have all been still the pain I'm having. So that is only the only thing. But that, again, that was a diagnosis, in a way, that was a diagnosis less, not more. But from October I had the mastectomy. I was in chemo. October the 2nd I had the mastectomy. I was in chemo in November. It was as quick as that. So that was wonderful, because, like I say, as soon as the diagnosis said it had gone further, it was get the chemo straight away to stop it, and that was wonderful. It's not wonderful having it, but it's nice that it happened so quick, because that settled you, because while you start thinking you've got a time bomb in your armpit, and I know the chemotherapy, all that does is stop it. It doesn't take it away, but it stops it, and that's all you want at that time. That's actually a really powerful description, that time bomb description. Yeah. And I assume then, by the help and the surgeries and later psychological input, you think differently about that now, in that you don't have that time bomb there anymore. Well, no, I hope not. I mean, I always thought chemotherapy was a cancer cure, but chemotherapy isn't. It just stops everything from spreading. That's why it goes through your whole body. Now, I didn't know that. I thought chemotherapy actually cured cancer. It holds cancer and makes sure there's none anywhere else. I think that was how it's described to me, which was why I had to have all that before they did the surgery again, to remove the last bit of cancer that they knew was there. And then the radiotherapy obviously is to catch anything in the breast area that may have been missed with surgery. So between all of them, I feel that my time bomb's gone. That's what I was meaning. Yeah. And that's a big change, isn't it? That's right. Although I'm left with a mess, odd boobs, everything else. I hope, and I'm pretty sure that they're sure that the cancer's gone, that was there. If it appears somewhere else, then that's a different thing. But my breast cancer has been cured, as far as the hospitals are concerned, to the best of their abilities, and that's what I've got to live with. And that's the hardest bit, actually, because they can never say it's gone. That is quite hard to deal with. They can never give you guarantees. No, they can never say you're cured, and that is quite hard. It's hard to live with uncertainty, isn't it? Yeah, and that's what I'm saying. Everybody that hasn't been diagnosed with cancer just carries on with their life, but once you've had the cancer, there's no guarantee that it's gone, and because you've had it, it is there in the back of your mind. How much do you think you're back to your normal self at the moment? Mentally, I would say probably 95, 90. I'm nearly there mentally. Physically I feel strong. I feel capable of doing most things, or I have to be careful this side with weight and everything. It is just as I say, it's dealing with this weight on my chest, and that is a good way to describe it. I think to remove this implant will hopefully make me feel more comfortable, and as I say, through Sue and through Jules, my head's back together.
That's good.
That was the hardest bit. I didn't realise just what a mess I was.
Psychological bit.
Yeah. I didn't, I just didn't know I was that way. You don't. It's mental health, I suppose. You're the only one who doesn't realise, and until you realise.
But do you see it now, looking back, how you were?
Yeah.
Do you see that difference in yourself?
I can. I was still trying to be so positive, but it wasn't there.
No, that actually tells me something really important.
The front was positive. The whole
which
inside
is you can if that depression is coming on, you can't just think your way out of it.
No.
With positive thoughts.
No.
You often need extra help.
Yeah.
And I'm just really pleased that you got that and you came to it.
Yeah. It took a while, but yeah.
I asked you about the effects on the family, but how did it affect your husband?
My husband he's been a rock. He has been so with me. He's come for every appointment. He's come in every room with me, and he's sometimes listened and took things in that I haven't. We went together on deciding on the implant. He came with me for chemo, although they're not allowed in with you. He came with me every chemo, and then just kept popping his head around to see if I was all right. He's been very supportive. He's had to work, but work was very good with him and let him have time off when I was having chemotherapy, when I was having operations, things. They've given him time off.
What line of work was that?
He works at Caterpillar.
Oh, yes.
In the warehouse in there. So he works 3 till 11, so a strange shift. So really it worked quite well because there was somebody there with me in the day, and then my son was home at night, or sons, depending which part of the year we're at. So he was there, and then my lads were there. So still couldn't get him to cook. He's not very keen on cooking, but he did his best, and he has been very supportive. And very careful with me, and strangely enough at the very end it's almost that he was almost frightened of this area, and I've said to him, it is okay to put your arm around me still, and he said, I'm frightened of hurting you. It's surprising how it does affect him that way, but he's just been ever so good with it. He's very honest, very straight, and between the two of us, we've dealt very well. He's the cup half empty person though, so he's had to change his attitude to deal with mine in a way, because we always say we work well together, because I'm the positive and he's the negative, so we do work very well together. And I think as I went negative, he lifted up and became positive, and that worked very well together. Sometimes
Partners, particularly when the patient had a breast cancer or another type of cancer, has an issue themselves adjusting to that change.
Yeah.
Just like we were saying about body image, sometimes the male partner has a problem with the physical change as well. And it can take them some time to get used to the difference.
As he has, as I said, we used to sleep with his, I'm going to be rude now, but we used to sleep like that, and this was his favourite one to hold as he went to sleep. He used to sleep with his arm, and of course he's lost his sleeping position. And it's very, very strange, and I sort of realised and noticed that this had happened. But
do you think over time he's actually come to terms with it himself?
Yes, he has, and I think we've become, as odd as it seems, after 33 years of marriage, we've become very close, very loving with each other. I think because we've spent so much more time together. We haven't got on each other's nerves. In fact, you know, because I've been at home all day, whereas I worked in the day and he worked in the evening, we missed each other most of the week. But, you know, because I've been at home, we've not gone out or anything like that. We've just been together. And I think that's brought us together in a way, which is nice.
That's great.
Yes, and he goes with what I want. He's never really says, "Oh, I don't think you ought to have that." He's just said, "You have what you need," which is really good. I actually start back work next week, which is very, very inconvenient because I've got to be off again after about 8 weeks. But let's hope that will give me a little return to work and a little return to normality.
A lot of people struggle when they go back initially after they've been off for a while.
That's right. I mean, I'm on a phased return, so I mean, my first week is 2 5-hour shifts, and it increases very slowly. So I'm hoping that I'm going to start as a new starter, because in 2 years the management's changed, the structure of the department's changed, all the systems on the computers have changed. So,
are you one of those people that enjoyed your job and wants to get back to
I did enjoy my job, although there's an awful lot of stress involved with it, because it involves costings and budgets and time scales, because obviously, as you know, we sneak in at night into shops, and we've got electricians and builders and shop fitters and all sorts in there, all within time limits. There's quite a lot of stress involved in getting that together. So after what I've been through, the new me thinks, do I want that? Or do I want my life as well? So by doing this job in this little phase, it might make the decision. And the co-op, very understanding on it, have said that if you don't think you can manage it, we will see if we can relocate you. So it working both ways. I'm hoping I can go back to it, but I'll see.
So it sounds to me like you're also looking at your priorities in life again and thinking about what's important, maybe planning for the future in a different way for yourself.
Yeah, I think now that although I'm 52, I've still got quite a bit of working time left. Maybe I want to work as a job, not for the job to be all of me. I want more me time. I've come out of the counselling and getting over cancer as thinking, it is my life. I've had cancer and I've got over it, but, and there is the but, people that haven't had cancer haven't got that thought, but once you've had it, the thought is there all the while. And it won't go away. I've been taught to put my cancer in a little box, shut the box, put it in the corner of the room, but the box is still there, and people that haven't had cancer haven't got the box with it in. It's hard to explain, but it's in the back of your mind all the while. But
how long are you able to go these days without thinking about it?
I do tend to think about it with the pain still, because it is a reminder of surgery. I suppose there'll always be the reminders, because there'll always be the scars no matter what. And
you've got another procedure potentially coming up.
That's right. Now, as I say, I'm looking forward to that, because Mr. Varma thinks that I would be more probably suited to the flap from the shoulder, but that involves an implant, and he wants to avoid implants now. So I've got to go for the bigger procedure, but I'm still looking forward to it. And that will be, after that will be my new start, I think. And I'll deal with what I've got to deal with after that, whether it be work as I am, or I tell them no, give me something different, because I want to live the rest of my life. I've got some life goals. I've got a wedding for my son coming up. I've just want some more me time now. I thought I wanted a career, but I don't think I do. I don't want to sit at a checkout for 5 hours a day. I think I'd be bored to tears. I want to use my head, but I don't want too many stresses and pressures. It's hard to decide, really, but...
Do you think the cancer itself has helped you in some way with these life goals?
Yes, I think through it all, you do suddenly become... You realise you're not immortal. I think nobody thinks of death. They don't. I could go out and get run over tomorrow, nothing to do with my cancer, but you don't go out and worry about crossing the street in case you're going to get run over. Yes, you get frightened on an aeroplane, but so does everybody. but we don't think of death. But cancer does make you think of death, and you suddenly think that if it's a bad cancer and it's moved, you might only have 2 years, you might have 10 years, it might never come back. There is that thought that there could be an end somewhere. And it's a very sensitive topic for anyone, because we don't tend to think about it. But now that you have thought about it, what's your view about dying? I mean, are you one of those people that can actually think about that prospect rather than just avoiding it and never thinking about it? I do, yes. You do think about it, and you think, you know, what will your death be like, I suppose. When I was very, very down, you do think that, you know, I'm going to Loros, and as I said, I had my counselling at Loros, and what is Loros? It's where people go to die. And that was quite hard to actually go there, yes, for a therapy that, you know, would help me realise I'm going to live. And I did say that to her, but that didn't. I lost a very good friend in Loros not long before I was diagnosed, which was also hard. But I've never. Now I don't think of my death. No. I still think cancer. Cancer's a horrible word, and that's the word you don't ever get rid of. But now I'm back to the positive person, and I need to get on with my life, not my death. I think that's the difference. Yeah. What does the future hold for you, do you think? I don't know. This could be a turning point in my life. I don't know, because, as I've said, my career may change. So this could have changed my whole life now. Well, it has anyway. I think, you know, the family have all been lovely. They've all got together. I've been very frank with everybody. You know, if somebody wants to see my wound, my scars, they've seen it. You know, I've never been worried by showing it them. As I say, it frightened my mum, it upset her. But I think I've wanted everybody to know what I've been through, what I'm going through, and what I'm going to go through. What was their reaction in general? One of my sons wants to know everything. The other one doesn't. It's really strange how different they are. The son that lives at home, he does. And now the younger son that's left, he's very like me. He's got my attitude. You know, he's a bit more quiet, a bit more to himself, and I can see that in him. So, you know, I tell him what I'm having done, but that's as far as it goes now. My oldest son, he asks lots of questions. I mean, I showed him the pictures of the reconstruction, and he sort of went, "Wow, that's a big one, Mum." But you know, he does want to know, and I've sort of been as frank as I need to be. My brothers, even my little nephew, he's 12 now. He was quite funny at the time, because when I said to him, I said, I've got to go in hospital, I've got to have my breast off, and he sort of looked at me a while, and he looked, and he went, "Is that an operation?" I says, it's an operation. He says, "It's only like having a tooth out." And I thought that, yes. But you know, he was interested, and he wanted to know, and I've told him. And yeah, I've said to my brother and sister-in-law, "Is that all right?" And they've said, "If he wants to know, you tell him." So I've told him what I've had done, you know, and he's come, and I went with my wig. That's the only time I wore the wig. I went one day in my wig. And I says, "Oh look, my hair's grown back." And he says, "No, it's not." And I said, "No, it's not." But it sounds like you had a sense of humour as well. Oh, I've had a sense of humour right through, and everybody has said that, and that's why they couldn't understand why I'd gone down, because right through it, I've laughed about everything. I'm even laughing now because I've got an appendix scar, and Mr. Varma said that could possibly end up on my breast. So that is going to be such a laugh to tell people, "Would you like to see my appendix scar?" Because it's going to be up here somewhere. But yeah, I have. I've always been positive and joked, and I'm sure it helps to have a sense of humour. But a big sense of humour, yeah. I guess no one's totally immune from potentially being stressed or distressed or depressed. That's right, and I think that was why I went so long, because I had this front on. In the end, I did have this front of being positive. Everybody says, "Oh, you're dealing with it, you're coping with it." You know, I went through it all, and I had the sense of humour, and I laughed and made jokes about no hair and the hole under my arm, and you know, everything was positive to everybody else. It was just myself. Yeah, it was myself.
Slightly different when you were on your own, maybe.
Yeah, and then you sit there and you think, oh dear, what am I dealing with? You know, has it gone away? And it does worry you. I was in a real flap when I had my mammogram after 18 months, which was January this year. My appointment come through for a mammogram, and I was in bits.
About going for the
other side.
Yeah, the retesting.
Yeah, and I was in bits, and I went to see Miss Shakui about a week before, and again I was crying, and she checked everything over and said everything was fine, and she said, what is the matter? And I said, I'm having a mammogram, and you know, she says, just a minute, and she come back in, and she's a lovely lady. She is so honest. I love Miss Shakui for that. She's not hard, she's not horrible, but she's very honest. And she came in and she says, now then, what's the matter? And I said, I've got my mammogram next week and I'm so frightened. She says, Deborah, your cancer is in your left side. We're treating the left side. Why are you worrying about that side? And you know, again, that was, and that lifted me up. That was another, why am I doing that? And you know, it takes somebody sometimes to say to you that. But
you needed that little bit of extra help and support at that time.
Yeah, and that just lifted me out, and I thought, why am I worrying about it? If it's there, I'll deal with it. I've dealt with this side.
Is that how you feel about it? That if something came up in the future,
I do.
You could deal with
it? You know,
that's a very strong
I am
approach.
So positive on that. I even said, you know, if I went back and they said it's gone in your knee, take my leg off. I'll manage with one leg. I will deal with it because I want to live, and I will deal with it.
You're very determined.
I am very determined. Yes. Yeah.
Well, I think that's a really impressive note to end on today, and I'm sure a lot of viewers will take a lot from that, especially that attitude that you got. So I wish you all the best for the future, and hope things go well.
Thank you.